The Significance of Nuclear Medicine by Bailey Schutza for the purpose of Chem 110N Lab, Section 4 for Fall of 2022. Introduction. What is nuclear medicine? Nuclear medicine is a specific field that recognizes, treats, and detects various cancers and other diseases. It is accomplished through the use of radioactive tracers and high-tech cameras that are able to detect them. So radioactive tracers are molecules that are tightly bonded to radioactive atoms, and the accumulation of radioactivity shows where the issue lies. So there's all kinds of different sorts of tracers, but they're most commonly given through intravenous injection. They can also be given through oral injection and then just be directly given to the organs as well. So this is done through the SPECT and PET scan technology. SPECT scans are single photon emission computed tomography, and PETs are positron electron tomography. So these are very similar, but there's a few minor differences between the two, such as the type of tracers used and what they're able to detect. But they're both very popular in nuclear medicine. And then the radiation in tracers is the same amount given in your typical chest X-ray or CT exam. So this is how a PET scan, for example, works. So over here, you can see the radioactive atom. It will go through different successions of decay, and it will emit a positron right here. The positron will react with an electron, and it will emit two photons, which that is what will be detected by the camera. For historical developments, it started in roughly 1934 after the development of artificial radioactivity. It was kind of coined by Frederick Joly Curie and Irene Joly Curie. However, Irene Joly's mother, Marie Curie, is most credited for her discovery of radioactive elements, her contributions to cancer treatment, and her mobile X-ray machines, which was in the early 1900s, that was used in World War I for being able to detect where bullets or different shanks were in soldiers. And then in 1946, a patient's thyroid cancer was successfully treated with radioactive iodine. And this was a significant development because that was the first time a radioactive tracer was successful in treatment. And then continued in the early 1950s to 1960s. That's when we saw the most rapid growth of nuclear medicine. And then in 1971, it was officially recognized as a treatment option, which is why we see it so commonly in treatments today. And then the 1980s, the first successful PET and SPECT imaging, which that is also important because those are the two most common scans we see today. And then in 1991, the FDA approved TC99, which we'll get into later, but it is very significant because it is in 80% of cases that use radioactive tracers. And then in 2008, the first hybrid PET and MRI was developed, and this is also significant because scans are a lot of money as it is, and if you can do two at the same time, it is time efficient. So that is important as well. Present developments, obviously just the usage of SPECT and PET scans as they become more common and more developed as well. Radioactive cancer treatment, that has been seen a significant growth in our present time today as more and more people and more treatment is being available. And then there was a PET probe recently FDA approved, and it allows for the diagnosis of Alzheimer's, which is severely significant because before this probe, doctors were not able to diagnose Alzheimer's accurately until after the patient was deceased. And then again, just the use of TC99 that has become increasingly popular in the medical field today. Future developments. It is hoped and pushing towards becoming a routine part of clinical tools. A brain PET tracer to visualize neurodegenerative disorders and psychiatric conditions, which that would be a significant contribution to the medical field in general. Simultaneous whole body PET and MRI that would also save more time, more money, and then advancements in cardiology and oncology. And then over here in this picture, you can see your standard bone scan, and you can see when one is used with TC99, how the areas affected significantly light up. Chemistry involved, obviously, your use of radioactive elements, radioactive decay and half-life, Marie Curie, and alpha and beta particles, as seen as the helium isotope over here, and gamma rays. So in this example, you have radium, and this is the example of Alfredin. It's a potential future cancer pharmaceutical. And so here, this one will go through decay, and it will produce radon and helium, but the helium here is a alpha particle, and that is what you would see in the scan. And then for the example below of TC99, the TC99 will undergo the reaction, and you will produce a gamma ray, and that gamma ray is what you would see in the light up in the reaction, or in the scans. So that is how the cameras are able to detect. Roles of other experts. There are many experts involved in nuclear medicine. So for one, you have the nurses and doctors certified in radiology and radiation treatment. The FDA does have to approve every single radioactive tracer. You have the EPA, which protects the environment, the NRC, which regulates like the nuclear emissions that are given off, the Nuclear Regulatory Commission, which I just said, the Department of Health and Human Services, Department of Energy, Department of Defense, Department of Transportation for transporting the radioactive elements and all that stuff, and Occupational Safety and Health Administration, and the International Atomic Energy Agency. And then all of these basically keep each other in check and in line and ensure the most amount of safety for society and patients. Positive societal impacts of nuclear medicine. Obviously, just cancer treatment, being able to get rid of that disease inside of your body and live longer than you would otherwise. Same thing with disease treatment. It's more effective, so doctors are able to tell exactly where and what the issue is faster and more accurately. Less invasive procedures, so it's not like a surgery you have to go in and see what's going on. A scan can tell you more quicker. Improved patient care, obviously just increasing patient care is incredibly important, and can detect early progression of diseases, as I said earlier, with the Alzheimer's, not being able to detect it post-mortem, but now we can before because of the probe. This can go for many other things like cancer. You can detect it more earlier on versus when you're in a later stage, which might not be as treatable. And this is just a little diagram showing you what to expect during a bone scan. So the radioactive tracer would be given. You would wait a few hours for it to go through the body, which is decay, and then you would go through the scan. And then eventually it all comes out. Usually the ones with less of a half-life come out quicker, so they're not in the body for very long. And then this is positive aspects of TC99, which here you can see the structural formula for, which is very complex. So as I was saying before, like TC99 does not stay in the human body for very long. It's typically has a half-life of 6 hours. It is the most common tracer, as again, I said it was 80% used in most cases, which is roughly 40,000 cases a day, which is insane. It's used to detect injuries, infections, tumors, heart disease, thyroid abnormalities, kidney issues, and some cancer procedures you can see it being used in. And then it is also common for bone, heart, lung, kidney, brain, white cell, thyroid, and lymph node scans. So, and additionally, on top of all of that, it is used in research studies. So it's providing researchers with more and more information. Some negative societal impacts are just the radiation risk and exposure. So obviously doctors are specialized in radiation are exposed to higher levels and more frequent radiation than your typical consumer. So these effects might affect doctors, so they have to make sure their safety procedures are intact. And then obviously for pregnant women, that is also a concern for little kids as well, since their bodies are different than your typical body. Cost. To put this in perspective, a CT scan without insurance is $4,000, about, which is incredibly insane. It's hard for a lot of people to just pay that. And so that is a negative effect of it, is it is expensive. And then it isn't 100% foolproof. Obviously, a lot of medical stuff is not 100% foolproof, so you can't guarantee that a certain outcome will come out, but the chances are high. And then in conclusion, nuclear medicine and its significant advancements over the years have just helped the medical field in general. They've helped with diagnosing, monitoring, and treating different cancers and diseases. And then there's many experts that are keeping nuclear medicine in check so that the most amount of safety is ensured to patients. And in all, the risk is worth the reward. And then here are my citations.